You know when you're going on a hike up a big mountain and you stop maybe halfway up and you're gonna have lunch there? It's a little bit of a break, but you know there's a journey ahead of you and you know you've come some distance. So where we are right now is like looking down and seeing the valley. So we know that we've come some distance and we can see that we've covered some miles and we've overcome some obstacles. And then looking upward, we still see a place to go. But we know that at the top of that hill is going to be the ultimate goal. That's what we're trying to achieve. And so I see us basically reflecting back, looking forward, and knowing that we're about midway in our path to something that's very good.
The government has imposed programs and services, and the way they run their governance lots of times is in silos. And so you're responsible for this part, you're responsible for this part, you're responsible for this part. And people don't want to kind of look over or go into someone else's areas of responsibility. But we're not made like that as humans.
We're about taking that decision-making that currently rests in Ottawa, that currently rests in Victoria, and create space for First Nations leaders to participate in all of that decision-making.
And so I think that's been the big issue, is around getting us all on the same page, meaning all First Nations in British Columbia, to kind of understand where we want to get to in health, self-governance of health, implementation of health services on the ground.
The early work of the Health Council was really about setting some governance standards in place. And so people have got to understand that developing anything, whether it's building a garden or rebuilding a nation or establishing an organization, it takes time. You can't just write it down and say, this is how it's going to be. You have to actually transform relationships before you can transform services or transform anything else.
Social determinants of health, I think, is a fairly new term, but it's not a new process or idea.
In my language, it would be referred to as pamatsuan. That's, and simply put, it's life.
It's the things that influence our wellness. It's the things that are in our environment. You know, it's the resources, it's the water, it's the air we breathe. It's about food security, access to that.
It's a challenge for, for instance, our urban society, our urban people that live in urban society. It's tough for them to eat healthy. Everything that goes on around us that's affecting our health, we have to deal with those things too.
Generally, if there's something going on in our life, it shows up in other ways. And so to be totally healthy, we can't just kind of think of health issues. We have to think of children, families issues, or education.
Education in many ways, not just education into the schools, but education on the land about the culture and the traditions that are slowly going to the wayside.
It's teaching our kids to hunt and fish, to understand why it's so important to eat the foods we do.
We have many institutions that are built in British Columbia based on contemporary way of doing things. We have education, an institution for education, justice, housing, children and families, and health. We need all those sectors to work collectively to develop a strategy that will rebuild our communities to wellness.
So for me, it's going back to the very simple institutions of our nations. It's around family, extended family, clans, ceremonies, ancestral teachings. It was about how we were all responsible for the well-being of the community.
So when I think about a complex concept like determinants of health, it's not. It's complex only because the outside world has put a label on it in a scientific environment and called it something. All it is understanding what my grandma told me. My behavior will be determined by my circumstance. My circumstance is determined by my behavior.
There was a way that we governed that looked after everyone. That was the role of the chief, to look after his haole, people, land, and resources. And principles that drove those were understanding that Ishukitsawak. All things are connected, so you be careful when you knock a tree down here what the downstream effect might be.
councils organized into regions. Our regions match the service delivery areas created by the province of British Columbia when they established the regional health authorities.
You know, and so part of this 10-year plan, yes, it's to take care of the present, but it's also about the past and about the healing that work needs to be done. And then the future is really about achieving our goals and our vision of self-determination.
It is important for all leaders to get together to really articulate a vision of wellness for their own community, but also to share best practices as to how one can achieve wellness, because certainly there are many challenges that may prohibit that. More importantly, I think it's really important for government to come and share the vision and really let go of the old style of governing programs. I believe that many of the programs are premised on policies that probably came from England and transported here in Canada. Well, those don't work for us, and it's proven in the past 100 years that it hasn't worked.
When you take responsibility for your own well-being, you will influence your family. You will influence your community. You will influence your nation. When you heal yourself, you begin the healing of your family. When you heal your family, you'll heal your community.
Miskli tanakwa tu shteil ta niskwen swalakwa. Stang east the shteil ta sumakhela. Yecha.
And I use the analogy of this canoe. And we all need to help build the canoe. We all need to get in the same canoe, and we all need to pick up a paddle and paddle in the same direction. And if we're not paddling in the same direction, we're not going to go anywhere. If you don't pick up a paddle, then somebody else is paddling for you. And so you need to pick up the paddle, and you need to get on board, and you need to go forward.
The then social determinants need so kaya den owitsen anuk takts anizye yoch lagay wat tata ba yezdel tektana wat yin kak so choha ba zdeli noel gan so choha ba zdeli di hanaya wat ta ewe tabi no bedis ta di yen takno nihlie wani yen sandla di tsana wat nito no tanin dil wat zanan so chat na no het en honil rekli hondli et will add an tioch flair as the dead deal yin kadani tsana wat no zel no yestai no winni sani nis deli hatsana wa yetzel tekla no ni no lea de honi lwani tla nuwe no lea de honi lwani di tsana wat skak chodale tsana wat na chehelie tsana wat di bitsanizye the nide astinsen die noch kanak so haltas nis del sel wani zakaten kanis wakatzen insen et noch yestai del cha sa del naswadi zalwani